Okay, good afternoon, everyone. We are at the Health Commission Finance and Planning Committee meeting for Tuesday, September 5th. Welcome, and would you call us to order?
Yes, I will call the roll. Commissioner Guillermo
Present.
and Commissioner Bernal.
Present.
I will read the land acknowledgement before we move forward. The San Francisco Health Commission acknowledges that we are on the unceded ancestral homeland of the Ramaytush Ohlone, who are the original inhabitants of the San Francisco Peninsula. As the indigenous stewards of this land and in accordance with their traditions, the Ramaytush Ohlone have never ceded, lost, nor forgotten their responsibilities as the caretakers of this place, as well as for all peoples who reside in their traditional territory. As guests, we recognize that we benefit from living and working on their traditional homeland. We wish to pay our respects by acknowledging the ancestors, elders, and relatives of the Ramaytush Ohlone community and by affirming their sovereign rights as First Peoples. We can move on to item 2, the August 1st, 2023 Finance and Planning Committee minutes.
Okay. See, we just need a motion to approve.
So moved.
Okay.
I'll check that there's some folks online. Folks, if you'd like to make public comment on item 2, please press *3. Or if there's anyone in the room who would like to make comment. All right, I see no hands, commissioners.
Okay.
So we need a vote.
Yeah, we have a motion, and I'll second.
And then we need everyone in favor?
Yeah.
All in favor?
All those in favor?
Aye.
Okay, great. We can move on to item 3, the monthly contracts report.
Good afternoon, commissioners. Okay, before we get started on the monthly report, I did want to respond to a question we received earlier today from Commissioner Green, who asked, does our DPH staff review the 990s for CBOs to ensure leadership staff's pay is within reasonable parameters and to see their other sources of revenue? Wasim Samara, who conducts the fiscal monitorings for the Business Office of Contract Compliance and participates on behalf of DPH with the citywide fiscal monitoring site visit processes, replied that we do review the 990s and make sure they are filed in a timely manner, but we do not review the salaries for reasonability of executive salaries. In terms of revenue sources, we do review the different sources a nonprofit has, but the goal is to make sure they are diversified and have other sources other than city funding. Additionally, while departments review agency-wide budgets during monitoring, which is a more current state view on salaries and cost allocations across contracts, the 990 is a look back and likely not the best source for that type of information. Departments also look at budgets during solicitations, and if they are concerned about executive wages compared to other staff, can address this during budget negotiations. For example, if a department sees a nonprofit is applying all of its cost of doing business increase to an executive raise instead of a staff raise, the department could choose to not approve that modification. The 990 is not really the source for that type of conversation, though.
Thank you so much for that information. I will pass it along.
Absolutely. Would it be helpful to have this?
Oh, yes, that's great.
Okay, in the monthly report, we have 6 items this month. Excuse me. The first item is with Haluna Health. It's a contract with PhD, with CHEP specifically. Requested action is approval of a contract amendment with Haluna Health to increase total contract amount with contingency to an amount of $4,047,436 and to extend the current contract term from April 1, 2018 to June 30th, 2023, which was 4 years to 10 months, to a new term of April 1, 2018 to 6/30/24 for 5 years and 10 months, extending it 1 additional year. The Health Commission previously approved this contract on February 5th, 2019. Haluna Health provides program administration and management services for the PhD Community Health Equity and Promotion Branch section to support a broad range of social marketing campaigns and educational activities. Of the proposed annual funding in the amount of $4,047,436, Haluna Health will receive a 12.1% administrative fee, totaling $436,878, with the remaining balance going toward programmatic costs. The proposed amendment exercises options under RFQ 36-2017, and funding will continue to provide support under program administration modality. Department is requesting the approval of this increase of $596,411 due to the following changes. The general fund cost of doing business increase of $6,508 for 23-24, a one-time general fund amount of $64,818 for fiscal year 23-24, a one-time carry forward in the CDC grant funding of $534,000 for the current fiscal year, and a decrease in the amount of $8,915 to the 12% contingency applied for fiscal year 23-24. Current contingency is $166,304. And as I said, the new, and also please note the, it's repeating, CDC grant in the funding amount of $534. If you have any questions, programmatic questions, we have Nicole Trainer, the Budget, Contract, and Communications Coordinator for Community Health Equity and Promotion, who's attending virtually and can respond to any questions you may have.
Oh, you're.
Any questions?
No.
I do have one question.
That's okay. It's Ms. Trainer. I'm going to mute you, Ms. Trainer, while the commissioner's asking the question. Go ahead, Commissioner.
Okay, the service description for this grant, the social marketing community engagement campaign, there's a $534,000 allocation with the balance of $476,360 for direct services. Is that a new aspect to this program that Haluna Health is doing from the CDC Carry Forward grant, or is that funding from?
I'll let Nicole respond to that question. She's probably familiar with what is and isn't. Thanks, Nicole.
Of course, Dean. Thank you for your question. No, the particular social marketing and community engagement activities are ongoing. We, unfortunately, sometimes we need to be creative and we don't necessarily have a base budget to support some of our social marketing activities, which also include our home-based testing program, which provides low barrier testing for San Franciscans. So what we've done, our unspent carry forward funds, we've added additional funds to this contract so that we can sustain those activities and we don't have to end them due to lack of funding. So these projects have been ongoing for several years now. Thank you.
Okay, so it's just an augmentation of that activity.
Yeah.
Okay,
And
great.
carry forward.
Thank you.
Thank you, Nicole.
That's good.
Any other questions?
Oh, no. So Commissioner, this is done at the end of the contracts report. We'll do them all at once. I think there's 8 or 9, so I will let you know.
Okay. Second item, also with Haluna Health and PhD, requested action is approval of a new contract with Haluna Health for continuing services. Total contract amount with contingency in the amount of $3,944,643. The contract term of January 1, 2024 to 12/31/2026, currently for 2 years. The Health Commission approved the previous contract on July 6, 2021 for a not to exceed amount of $4,932,239 and a term of January 1, 2016 to 12/31/2023. Haluna Health will continue to provide program administration and management services for the PhD division, for the Center for Public Health Research section to support the National HIV Behavioral Services, or NBHS, activities. Of the proposed annual funding, Haluna Health will receive 12.1% administrative fee of $425,763, with the remaining balance of $3,518,700 going toward programmatic cost. The new agreement exercises administrative sole source 21.42 authority, and funding will continue to provide under program administration modality. The reasons for the funding change is due to a CDC grant funding in the amount of $1,250,364, or about $416,788 annually. For the NHBS core funding, CDC grant funding in the amount of $1,131,288, or about $377,096 annually. From NBHS, National HIV Behavioral Surveillance Trans funding. Third item is CDC grant funding in the amount of $690,351, or about $230,117 annually for the NHBS WES funding, the CDC grant funding, the amount of $450,000 or $150,000 annually from NHBS for transviral hepatitis, and the amount of $422,640. It's a 12% contingency value provided. If you have any programmatic questions, we have Dr. Willie McFarland, who's the director of the Center for Public Health Research. He's attending here in person. If you have any questions, we'd like to ask him about this new grant program.
Thank you. Are there any questions?
Yes, quick question. So first of all, very important programs. This just sounds like it's only for the back of the house administrative functions, right? Not actually administering the programs themselves, correct? Or conducting the studies that are funded.
Oh, could you, there is a microphone at the podium. It's that bar. So just speak to it, please.
This thing?
Oh, no, it's just talk.
Bar itself.
It'll pick it up.
Sorry.
It's a new system for all of us, so we're all getting used to it.
I'm not sure I fully understood the question, but I think you were saying
Just in reading through this quickly, it looks like it's all back of house administrative functions like HR and other things like that. It's not actually conducting the surveys that are funded through this grant.
no, it is, the full amounts do include the survey.
Okay.
The overheads of 12% would be the
Oh,
administration.
got it. Okay. All right. Got it. Great. Thank you. Nope, that's it.
Okay, we move on.
Thank you.
Thank you.
Okay, third item is Trifecta Incorporated. Requested action approval of a contract amendment to increase total contract amount to $15 million and to reflect a new term of June 1, 21 through December 31st, 24, or an extension of 1 year to procure additional as-needed nurse registry services for DPH. The Health Commission previously approved this contract on July 6, 2021. The department has experienced a great increase in the need for as-needed nurse registry services in addition to past issues such as COVID and other emergent issues. Ongoing recruitment and staffing issues continue to drive the need for nursing registry services. Laguna Honda Hospital and Zuckerberg SFGH continue to experience many vacancies among nursing staff due to retirements, resignations, and staff leaving for other positions. Regional and nationwide challenges in the recruitment and retention of nursing professionals continues as well. The annual amount of this as-needed contract has been increased to better be able to meet this need. The proposed amendment is subject to approval by the San Francisco Board of Supervisors. And you have all the information there. The previous contingency was $964,286, and the current contingency will be $642,857. If you have any questions, Maria Roella Antok from the Nursing Administration at Laguna Honda Hospital is available remotely to respond.
Thank you. Any questions?
No.
No questions from me either.
Great. Thank you. Item number 4, Jamestown Community Center. Requested action on the approval of a new grant agreement with Jamestown Community Center, contract ID number 10000028580. For a total contract amount with contingency of $1,232,421 for a contract term of July 1, 23 to June 30th, 2025 for 2 years. While this is a new grant agreement, it is for continued services that were previously approved July 5th, 2022 by the Health Commission under contract ID 10816. The contract is to meet the unique needs of low-income Latinos of San Francisco and build social emotional skills to increase activities leading to a healthy life and decrease the risk of alcohol and illicit drugs. Proposed new agreement exercises grant agreement sole source authority. If you have any questions, Chris Lavoie and Rebecca Matthew from the Children, Youth, and Family System of Care are available remotely to respond.
Thank you. Any questions?
No questions here.
I had one question. It says here, this is a programmatic question. Target population is ages 5 to 18. I'm just wondering how a program that is focused on the reduction and prevention of illicit drugs and alcohol addresses that age population, particularly on the younger side, 5 years old. I'm not sure what that looks like.
Good question.
Yeah.
Chris or Rebecca?
Sure. I'm happy to answer. This is Rebecca. I am the SUD program manager. Actually, CYF covers 5 to 18, but the prevention services actually starts in 5th grade. Prevention is specifically 5th grade to seniors in high school.
We should probably correct that then in the service description, just so that it's clear who the target population is. Okay. Because if it did target ages, I'd be very curious as to what type of curriculum that might, and
As
if it
would
was
we,
effective. I
as
mean,
would
you
we,
don't know.
yes.
Yeah.
Thank you
Yeah.
for that. And noted, we'll make that correction.
Yes.
Thank you.
Okay, next one. Number 5, a Youth Leadership Initiative. Requested action is approval of a new grant agreement with Youth Leadership Institute, contract ID 28579, for a total contract amount with contingency of $1,229,059 for a contract term of July 1, 23 through June 30th, 25 for 2 years. While this is a new contract, it is for continued services previously under contract ID 10693. Contract was not previously presented to the Health Commission as it did not meet the threshold requirements, as it now does. Again, if you have any programmatic questions, we have Chris and Rebecca from Children, Youth, and Families to respond.
Thank you. Any questions?
Nope.
Okay. I actually had a question on the evaluation or on the review comments. It says here on the monitoring, the program for Youth Leadership Institute met 33% of its contracted performance objectives. And in the notes on the monitoring, there was, it says that no data was provided by the associate and no response was received from the program for data requests for 20% of the objectives. I'm just wondering how the monitoring is going currently.
That's a good question. Chris or Rebecca, are you able to provide a little bit more insight on that for the performance?
Yeah, I think, well, it was predominantly because of the pandemic. We were still stuck in the pandemic, and there was a lot of client departures, and they weren't actually engaging in the services quite as much as they are now. And they are doing better, and we are meeting with them more regularly, and there is more of a monitoring effort in place. And they, as far as I'm aware of now, there's no indication that they're off track considerably with them. And I think given the increase in the frequencies of meeting with them, we would want them to tell us if they were off track with anything. So we can circle back to you with that confirmation if that's something you would like. But I think that they should be on track this year for fulfilling those objectives. Is our estimation?
Okay. I don't think you have to report back. It's just something of note. And then actually, I had the same sort of question for the Jamestown's community program grant, just some close monitoring that's warranted. And I don't think that in each of the individual grants necessarily need to come back. It just will look for better survey or better monitoring in the future, right?
Yes.
Monitoring results, right? So I'm
Yes.
sure you're monitoring well. Yeah.
We like to think we are, yes, but
Yes.
I think we're working actively with our business office around the contract objectives and how to measure them, and I think we're coming to a new consensus about how to do that.
Yeah.
So it should be improved.
Yeah, and this is not to say that I'm questioning the organization at all. I'm just saying if they need assistance and help, or if there's any area where there's some, some needs for the, I guess, some support, that we're clear that we're providing that support in order to make sure that they are as successful as they possibly can be.
Yes.
Yes.
Yeah. I think we are. Yes.
Thank you,
And we'll
Chris.
continue to do so.
Thank you.
Thank you.
Thank you, Chris.
Sure. Take care.
Next item.
Mhm.
The 6th and final contract in the monthly report is with Health Advocates LLC. Requested action is approval of a new contract with an existing vendor for the same services. Health Advocates was originally sourced through RFP 16-2012 and has been providing this service since 2014. DPH issued RFP SFGov 8427 on June 20th, 2023 for uncompensated care reimbursement recovery services. The new contract terms and options are authorized through that solicitation 8427 with Health Advocates and being selected as a proposed vendor. Total contract amount with contingency, an amount of 10 million with the proposed contract initial term, as stated of January 1, 24 through 12/31, 2029 for 5 years, plus an option to extend for an additional 4. This option will only be exercised if the department has a need and funding is available. FYI, I just wanted to include that. This was previously approved at the Health Commission on May 4th, 2021. They provide uncompensated care reimbursement recovery services, as I said, since 2014. And from July 19th to June 2023, Health Advocate LLC estimated total reimbursement recovery revenue is $73,509,073, with an average of $18,377 per year. And again, this proposed amendment is subject to approval by the San Francisco Board of Supervisors. If you have any programmatic questions or other related questions, we have Janine Smith, the manager with the Patient Financial Services Department of ZSFGH, who's here to respond, I believe.
Thank you. Any questions? Just, I'm not sure how this over time gets reported, but it seems as if there's a successful recovery rate that we're seeing here compared to the annual cost of the program. Just wondering how the data on this might be reported, particularly in relationship to any goals that we might set, financial goals that we might set for recovery.
Do we have Marcus Janine Smith on the call?
Janine, could you respond to that question, please? I'm going to mute you.
Oh, sorry.
That's okay. There we go.
Hi, can you hear me? Okay.
Yes.
Okay, I apologize for that. So, yes, I'm Janine Smith, and as far as the recovery rate, so Health Advocates does provide quarterly reports to us of their successes on the accounts that we are referring to them, both from an inpatient and emergency room department admissions, for which we seek their services for our uninsured population. So during their quarterly reports, they are providing us with the statistics of their, not only the total referrals, but also their successes in what they are able to acquire from Medi-Cal or other insurance coverage. And with that, the cost and reimbursement that we are seeing from the successes, so that we're able to track it over time to see the benefit of what they're invoicing for and being reimbursed compared to the reimbursement that the hospital sees.
Thank you. And just to be clear, these are efforts to collect from third party and other insurance, not from the self-pay patients themselves.
That is correct. That's correct. Predominantly Medi-Cal, but also commercial insurance, third-party liability, workers' comp as well.
Okay, great. Thank you.
Thank you.
That was the last one.
Okay, great.
Commissioners, now please consider a motion to approve the entire contract report. And actually once you make the motion, I will go to public comment to see if there's anyone there before you vote.
Motion to approve the contracts report.
Okay, second.
All right, folks on the line, if you'd like to, or anyone in the room, if you'd like to make public comment on item 3, the contracts report, please raise your hand in the room or do so by pressing *3 remotely. Okay, nobody in the room. I don't see anybody remotely. So commissioners, please just do the final vote.
Okay, all those in favor?
Aye.
Aye, thank you.
Fantastic. Thank you. And thanks for all those who participated. We can move on to item 4, a request for approval of a new contract with Health Services Advisory Group. I believe we have Baljit, Mr. online. Yes. Hi.
Hello. Good afternoon, commissioners. I have a brief kind of 3 to 4 minute kind of update to contextualize this contract, and then after that, I'm happy to take any questions you may have. So, regarding the contract before you today, when Laguna Honda became decertified 16 months ago in April 2022, the emergency contracting procedure was utilized to get CMS regulatory experts and resources to Laguna Honda as soon as possible. Since then, there's been a substantial and significant evolution at Laguna Honda thanks to the guidance of these experts and with partnership with the staff to whom they've been providing the guidance. Now, one of the major accomplishments has been a successful recertification in Medicaid last month, and now we're in the survey window for Medicare, and we eagerly await that survey to occur imminently. That said, we're now looking to the future with the focus specifically on sustaining the structures that led to successful Medicaid recertification and what we believe will be a successful Medicare recertification, all with the focus of supporting Laguna Honda and stabilizing the organization. Now, to ensure we successfully pass all surveys in the coming year, the CMS regulatory expertise is key to this, and HSAG's role in it is critical. So we are pleased that this contract is before you after a formal RFP process. The last thing I'll say is, as a reminder, the structures that we aim to continue that have been a major contributing factor to the success here is technical assistance and targeted support to Laguna Honda staff, all levels, frontline to leadership. Participating as subject matter experts in specific committees, not limited to infection control and prevention, environment of care, resident council, the quality assurance and performance improvement committee, and PIPs. Also providing guidance to our nursing home administrator, directors of nursing, infection prevention, QAPI, and the behavioral health leaders. And finally, to continue the consistent care at the bedside program for each of the 13 nursing units that assesses the current day-to-day staff activities, identifies areas for improvement, along the lines of reviewing reports, trainings, meeting with residents weekly, evaluating care plans, and providing input to the leadership about any issues. And the last thing I'll say before I field any questions is that this part of this contract in the next year will be developing then a transition and sustainability plan with the Laguna Honda leadership, including the leadership for the vacancies that we still have yet to recruit, and the staff that really describes all the handoff tasks from HSAG to Laguna Honda, and really with the goal of sustainability post recertification for any and all state, federal license surveys, and all that. And then on this latter point, there will be a presentation due to come before the Laguna Honda JCC in the coming weeks, describing this transition and sustainability plan in further detail. So I'll stop there and happy to take any questions that the commissioners may have.
Thank you, Baljeet. Are there any questions?
Before we do that, may I ask for public comment on this item?
Sorry.
Sure, no worries. Folks on the line, if you'd like to make comment on item 4, please press *3. All right, I see no hands.
Okay. No questions. I do have actually one brief one. Do you anticipate, and I know it's hard to know now, but just sort of for reference in the future, that after August 2024, if we've gotten the Medicare recertification and everything is going well with sustainability, that we will continue to need the services of HSAG?
I do anticipate that we will continue to need the services of such a regulatory partner because as you'll see in the forthcoming presentation, our goal is to now institute as part of our culture kind of a quarterly monitoring evaluations just to make sure there's no slippage to ever occur again. And so I do know that said, such a service will and partnership will be needed. At this point, though, given our requirements for our contracting with the city and county, I can't be definitive to say it would be HSAG, but I can say that we would have such a partnership embedded into our practice.
Okay, and it would be primarily for sort of the sustainability efforts, or will it be, are you projecting that this might be for just preparations for, the regularized, the normal surveys that we will be in, that Laguna Honda will be experiencing with our regulatory partners?
Yeah,
agencies?
absolutely. So you're absolutely right. It would be for sustainability. And the idea is if we're sustaining what we're doing, we will be in full preparation and ready to roll for any surveys that are coming. And then the one thing to further clarify is the ongoing partnership wouldn't be what is before you today. It would not be, this scoped contract for just a year for this size. It would be more quarterly immersions, like 1 to 2 week efforts every quarter to keep us apprised. But it would not be something this in depth when we speak about kind of the ongoing sustainability and the ongoing monitoring of our progress.
Okay, I'll look forward to that. Thank you.
So commissioners, you can now, if you would, please consider a motion to recommend that this be approved by the full commission.
So moved.
Second, all those in favor?
Aye.
Wonderful. Thank you. We can move on to item 5, the request for approval of a new professional services agreement with Marina Security Services. Mr. Price.
Good afternoon, Commissioners.
Good afternoon.
All right, so request for approval for the Marina Security. This was actually approved by the Health Commission back in 2001 as we proposed this for our changes as far as our security plan in the community clinics. The whole point is to have community peer-based patient safety ambassadors at 4 locations in the community clinics. The whole purpose behind this was to reduce the presence of law enforcement and its impact on our patients in those clinics. And what we've learned from Maria's security services is that it's not a traditional guard service, but they actually do have a community ambassador division that will go through the DPH required training with regards to trauma intervention, nonviolent crisis intervention, as well as implicit biases. Just moving us in the right direction of where we've been trying to go for the past 3 years to just have a alternative staffing model to law enforcement presence. And so I ask for your approval on this contract.
Okay, are there any public comments?
Folks on the line and in the room, if you'd like to make comment on item 5, please raise your hand in the room or online by pressing *3. All right, I see no hands anywhere.
Okay, any questions?
No questions. Motion to approve.
Okay, second?
And all those in favor?
Aye.
All right, thank you, Mr. Price.
Thank you, Commissioner.
Item 6.
Price.
Item 6 is a new grant agreement request with Asian Pacific Islander Wellness Center.
Good afternoon, Commissioners. My name is Krista Gata, and I am here to present a new grant agreement with API Wellness Center, who is subcontracting to Code Tenderloin to perform a new program called Tenderloin Night Navigators. I'm also joined by 2 of my colleagues, Terrell Jones, Stephen Rice from Code Tenderloin, and we're happy to answer any questions that you have. So as part of the Tenderloin Action Plan that's being supported by the San Francisco Planning Department, the city, the mayor allocated funds for community-led programs that would improve the conditions in the Tenderloin neighborhood. The planning department held a participatory budget process last fall that allowed stakeholders in the Tenderloin, business owners, community, nonprofits, folks who live there to vote on projects that they thought would best improve the conditions in their neighborhood. And the Tenderloin Night Navigator program was one of the selected programs. The planning department approached us as the goals of the program do align with DPH's mission to improve public health. The Night Navigator program provides or will provide trauma-informed crisis intervention resources and referral services during the nights and weekends in the Tenderloin. So they will be available 4 days a week from 7 p.m. to 3 a.m. And for those of us who work in the Tenderloin, know that like once 7 p.m. hits, things change a lot and the resources aren't really there. So we're really excited about this program really filling a gap and sort of meeting people's immediate needs, providing resources and referrals, and then connecting them next day to case managers, both at API Wellness Center, but also Code Tenderloin for medium and long-term case management. So any questions you have, I'm happy to answer.
Thank you. Is there any public comment?
Folks online, we're on item 6. Please raise your hand by pressing *3 if you'd like to make comment on this item. I see no hands.
Do you have any questions?
No questions.
You might have mentioned this, or it might be somewhere in information I'm just not seeing. How many staff do you project will be part of this Night Navigator program?
Yeah, good question. And Kate, I'm sorry, Kate Franza from API Wellness is also on the call. Kate, if you have it in front of you, I actually don't. I think there are going to be roughly 4 to 5 staff during the 4 days, plus the case manager that works on the Monday through Friday schedule.
Yeah, can you hear me?
Yes.
Yeah, I'm just pulling that up. That's right. So one of that includes the management oversight and then the 4 night navigators is what I'm seeing, but I'm just pulling that up.
Yes.
Okay, thank you. Just a comment as someone as a child, I was spent a lot of time on Hyde and Turk when my father had a barber shop there. Yeah, Mill Studio Barber Shop for decades. So really glad to hear that. Anytime I hear of programs in the Tenderloin, I see the support and just hoping that the staffing is sufficient and that folks are safe and
Yeah, absolutely. Yeah, that's certainly very important to us. I mean, we understand the risks that can come at late night services. They have they have scooters that they're going to be able to get around quickly in. They have a van, and then they do have a home base that they can be in. And we're really excited. We've been partnering very closely with Code Tenderloin in our work in the Tenderloin, partnering with SFPD, with the ambassador programs, and with HSH. So I think we're all working very well as a team.
great.
Mhm.
Be looking forward to hearing how things
Yeah.
go with this new program. Okay,
Thank you.
So we need a motion and then a vote.
Motion to approve?
Second, all those in favor?
Aye.
Great. And if I can note before we go on the next one, Ms. Guetta was also a leader at the TLC. And just noting your involvement in the Tenderloin and your understanding that we've got great DPH staff working in various programs, even if one ends, new ones begin. So just thanking you for your service.
Thank you.
Thanks for being
Thank
here.
you. Thank you very much.
Moving on to item 7, which is a request for approval of a new grant agreement with Richmond Area Multi-Services.
Thank you. So yes, also here to present a new grant agreement for the Richmond Area Multi-Services, or RAMS, as most folks know them, for peer staffing on our Best Neighborhoods team. Best Neighborhoods is a newly reconfigured, as of March of this year, behavioral health outreach team, which is a partnership between RAMS and the Department of Public Health's Office of Coordinated Care. The team works in neighborhoods. They are street-based, and they provide intensive, everyday outreach and engagement to folks who are unhoused and experiencing very complex behavioral health issues, and who are also experiencing significant distress in the community. So most of our referrals come from the street crisis response team and from the community themselves, and also Healthy Street Operations Center. This is a very, as I just sort of described, this is a highly collaborative team who, I was sort of mentioning in my last, is working with Code Tenderloin and some of the other groups to be very place-based. So being in a particular neighborhood every day so that you really get to know the people in the neighborhood, the resources in the neighborhood, the other workers in the neighborhood, with the goal of really identifying and following up with the folks most in need and really providing that intensive care so that they can transition to other levels of care. So enhanced care management or intensive care management into shelter and long-term health services. This is a multidisciplinary team with peers being kind of the cornerstone with their lived experience and really being able to engage and navigate systems, but also paired with behavioral health licensed and pre-licensed clinicians and health workers. We're working hand in hand with folks to really wrap around and partner with the other agencies. The team meets weekly and does care conferencing across city departments. And we've seen a lot of success really early with the team. We are asking for some retroactive funding. This team did with RAMS start in August. And already in that time, in their first month with half a staff, they already engaged with 330 people, have made countless referrals and connections to mental health and substance use disorder treatment. And we're really, really excited to partner. And I see that my colleague Hassan is from RAMS is on the call as well. So happy to answer any questions.
Public comment?
Folks, we're on item 7. Please raise your hand if you'd like to make comment by pressing *3. I see no hands.
Questions?
Yeah, just a quick question. I'm sort of a drop-in on this committee. I don't usually come in here, but I'm here to help out. So apologies if I'm asking a question, because it is kind of a broad question here, but specific to this program, you had mentioned that even though having low staff, there have been more than 300 engagements, very large number of referrals. What what kind of data is collected on the actual uptake of the referral?
Yeah, so right now we have two primary means for collecting data. The first is every day we're collecting just through an MS form. So every day the teams report out at the end of the day, how many people did you engage? How many did you refer to mental health, substance use, or medical services? And how many did you connect? That's always a lower number than we know because we have to confirm the connection. Did you walk them there? Did you confirm on the other end? I sent you and I called and I checked, so those numbers tend to be undercounted because we don't know if somebody goes the next day and we just didn't see it. We also count the number of Narcan we give out and also the number of shelter and shelter connections we make. We do have some access to shelter beds and we work hand in hand with HOT, the San Francisco Homeless Outreach Team, to connect folks. Also, we just got into Epic as of August 1st.
Great.
We're very excited.
Congratulations.
And so, so we are tracking what we call is shared priorities. So we may have 330 people that we engaged with, but we have about 50 people that we are working very, very intensively with. They are on our care load. We mark them as shared priority. This is kind of a known sort of thing now that we try to open every door and work with every team, care conferencing around them. And we are doing Epic notes in there. So I'm very excited about the future of being able to collect some more longitudinal person data.
So VHS just went live with Epic on August 1st.
VHS is in the process of going live with Epic, and our team was lucky enough to get
great.
in August 1st.
So then Epic will track all of the data points you're talking about, including engagements, referrals, and connections.
Yeah, and so we're not going to be able to Epic track for every single. If you should come out one day with us, we see a lot of different.
Invitation accepted.
I always think I think it's great for people to see. Actually. I always learn a lot when I go out with the team too. So we have a lot of different types of connection points. So sometimes it might be as simple, just, hey, how are you doing? You're not going to give me your name today. But I'm going to talk to you a little bit and maybe give you some Narcan. Maybe I'm going to give you a hygiene bag. Maybe I'm going to take you to coffee. We aren't going to be able to probably track that person in Epic right away. But once we see you for a little while and you get onto our caseload, then we're going to put you into Epic. So we sort of that's why we kept the MS form, because we didn't want to lose what is actually a really critical component of outreach work, which is those everyday sort of light touches that sometimes turn into much longer and more meaningful engagements.
Great. Thanks for indulging my geeking out on data. Thank you.
No, it's cool. I love it too.
Yeah, good.
So sort of to follow up on Commissioner Bernal's question, so are there any sort of research study opportunities that are going to be attached to this program? I mean, given, this is unique and difficult, right? So it's a case to be made if you're going to be able to capture that data, particularly systematically in Epic and longitudinally, over time. I would imagine that it's just something that we if successful, or I don't even know how you measure success at this point, but you might be able to then come up with measures of success that can be applicable across other types of programs.
Yeah, that is a great suggestion, and we don't have something currently lined up, but I will absolutely take that back. I really agree with you. I think what we've created here and are continuing to iterate, especially with our new partnership with RAMS, I think is really special and is showing some great results. But finding a way to really capture that and developing best practices going forward, I think is important. So
great, and I also want to. Sort of congratulate the partnership with RAMS. I'm showing my San Francisco roots here. This is somebody who also was familiar with RAMS when they were in the Richmond District, Community Mental Health Services, and many, many decades ago as well. So just glad to see such an institutional partner partnering with DPH. So
thank you.
So we get a motion and a recommendation, please.
Motion to approve.
second, all those in favor?
Aye.
Aye.
That's great. Thank you. Item 8 is a request for approval of a new professional services agreement with PSJ Provider Recruitment, LLC.
Okay.
Scott DeWolf.
Afternoon, Commissioners. I'm Scott with the Merit Recruiting and Assessment Team. We are pursuing this recruiter agency to try to help with the ongoing doctor shortage we've seen in primary care and psychiatry shortage in behavioral health. We found this provider as one of the Vizient vendors and had vetted them and talked with them. And this looks like a good opportunity for us to really expand our search nationwide for physicians to work in our clinics and obviously in our psychiatry areas. The initial contract, I think we're going to be trying them out basically for 12 months, see what we can do. We're really going to focus on hard to recruit positions, things with possible language needs. And obviously in the psychiatry side, that's just very difficult to recruit right now in the Bay Area, and especially in California with cost of living and other things. So we're really hopeful that this particular recruiting agency will help out. And I believe this is, in my recollection, the first of its kind we've used in a while to hire for physicians specifically. Any questions?
Is there any public? Yeah, thank you. Thank you. Public comment?
Folks, we are on item 8. If you'd like to make comment, please press *3. No hands, commissioners.
Okay, any questions?
Yes, first of all, my understanding is they're a nonprofit, is that right?
Correct.
Okay. So, and this is something that comes up to the commission a number of times, really the impact of having unfilled positions, not only on the work that we do, but on the other people working in those areas. What is it that they will do specifically to fill those positions in terms of, for example, speeding up the amount of time it takes? I know that there's so many challenges around cost of living and the actual pool of possible applicants, but will this actually speed up the amount of time that it takes to fill a position?
I think that's a great question. What we're really focusing on is the exempt, so the 2230 and the 2232. So those are exempt recruitment processes. We believe that working with them and with some of their best practices, they'll be able to help us even with our own processes in HR to try to streamline some of that. But I think the bigger ask that we have of them is to really help find folks in primary care that will come and do this work and relay back to us what the actual candidate pools out there looks like. Like, do we need to be flexible with in terms of scheduling? Do we need to really right size ourselves with what the industry looks like, given their really focus along the whole West Coast? If you have any background on this, organization is out of Oregon, and they've done a lot in Northern California, like beyond San Francisco up to the Oregon border. And they've had a lot of practice with more in specialty area physicians in a hospital setting that they said they have enough experience with primary care to make a difference in that. And I will say, this firm was not coy on the fact that they said this is going to be challenging, right? They were not selling us a silver bullet by any means. And I think for me as the manager in this, I really wanted to hear that honesty to know that, yes, we're going to be going, hand in hand through this challenge. And they didn't basically say, oh yeah, we can do this easily. They very much knew this is going to be a lot of work.
And you said it's a 12-month grant period?
Well, 12 months initially with option to extend for 19 months.
I mean, because as you know, whether or not having a full complement of staff, the critical work of DPH continues, and there is an impact and a strain on the staff who are there trying to cover for not only their own work in open positions. So it's something that the commission takes very seriously, and hopefully this will yield positive results.
We hope so as well.
Yeah. Thank you.
Just a comment, I know PSJ is associated with Providence St. Joe's, which is one of the largest hospital systems in the U.S. And I would hope then that we would be able to draw on their experience, not just the LLC part of it, but the whole system's experience with recruitment of the best talent in executive positions or high-level exempt positions that we're looking for. It's sort of a unique way of doing it, not going with a traditional sort of headhunter agency, but going with a nonprofit that's associated with a system that has some of the same issues. They're also a values-based system. So I think that in that respect, they'll understand what we're trying to do in San Francisco to get the best, and also people who have that kind of care for the patient, the residents that we show at DPH. So interesting.
Definitely alignment on the mission-driven focus for sure. And we had that gleaned from them just in their conversations. So
Great. Okay.
thank you.
All right. Thank you. No other questions?
Nope.
Okay. Can I have a motion?
Motion to approve.
Okay, second. All those in favor?
Aye.
Aye.
Thank you. We can move on to item 9, which is it's a request for approval of a new contract agreement with Haluna Health, working in conjunction with DPH, Center for Learning and Innovation.
Good afternoon, Commissioners.
Good afternoon.
Jonathan Fuchs from the Center for Learning and Innovation. It's my pleasure to talk to you today about a request for approval for a new contract agreement with Haluna Health in concert with a new grant from the Centers for Disease Control Call and Prevention called the Public Health Infrastructure Grant. This is unprecedented funding, $3.2 billion to 107 jurisdictions around the United States to support workforce development in a non-categorical fashion, supporting recruitment, retention, sustaining, and training the workforce, as well as strengthening foundational capabilities in public health. The capacity strengthening that we hope to do includes a number of meaningful internships supporting key positions, the administrative support around website support for LearnS at DPH so that we can provide training to community-based partners. We've worked very closely with Haluna Health over the past 10 years around our capacity building work around HIV prevention, as well as through our NIH-funded summer HIV/AIDS research program. So we look forward to working closely with them to administer this program over the next 5 years. And I'm happy to answer any questions you have.
Okay, is there any public comment?
Folks, we are on item 9. If you'd like to make comment, please press *3. I see no hands.
Okay. Any questions? Okay.
No questions?
No questions here, just really actually very interested in these non-categorical. So that's sort of it's a lot to try and manage. So very interested to see how it's not new, is it? Is it new?
It is. This
Is
is
new?
a new grant, really unprecedented funding from CDC to support workforce development, but not specifically in any one particular area, whether it's HIV or STIs or environmental health. So it's really a broad mandate.
An emergency response too.
An emergency response.
Yeah. Great.
I think that this is a great opportunity to also, in terms of trying to really sort of help train a diverse workforce, one that reflects what we need here in San Francisco and in the Bay Area, actually. So,
Completely great. Thank you.
okay, great.
Motion to approve.
Okay, second, all those in favor?
Aye.
Aye.
All right, thank you. All right, the last contract request is approval of 2 new contracts for as-needed facilities maintenance with a Western Indoor and Red Dipper. Mr. Saltz.
Good afternoon, Commissioners.
Good afternoon.
What I have before you is 2 new contracts for facilities maintenance that would accompany our family of facilities maintenance contracts. We have well over 35 contracts in all. This is 2 new contractors that we haven't worked with before. One is Western Indoor for duct cleaning and Red Dipper for fire-rated door assemblies. They will accompany other contractors under the master contract. And I'm here to answer any questions.
Hey, is there any public comment?
Folks, we are on item 10. If you'd like to make a comment, please raise your hand by pressing *3. I see no hands.
Okay, any questions?
No questions.
Okay, no questions from me. Motion?
Motion to approve.
Second. All those in favor? say
Aye.
All right, thank you. And to those in the room and those participating remotely, we are postponing item 11, the Finance and Planning Committee calendar planning, because 2 of the members of this committee are absent today. We will reschedule when we have a full quorum of those folks. Item 12, emerging issues. Commissioners, anything from you?
It's your opportunity, Commissioner Banal, to contribute to the committee's workload.
I will leave this to the regular members of the committee. Thank you.
Okay, thank you. President, you have enough on your hands.
And folks on the line, if you'd like to add anything, emerging issues, item 12, and also 13, public comment, or 4 times where members of the public can make comment for up to 3 minutes on issues that are not included on the agenda. So press *3 if you'd like to do so for this item. All right, and then I'm calling also for public comment, item 13. Do the same thing. Press star 3 if you'd like to make comment. See no hands, so we can move on to a consideration for adjournment.
Motion to adjourn.
Second, all those in favor?
Aye.
Aye.
Okay, thank you. Give me 30 seconds to shut us down. Thank you so much, everyone, for attending and for watching.